I'm here with Phillip Shoe. He has a Master of Divinity degree and a Master of Theology degree from Duke University, and he's also working on a Master's degree in Mental Health Counseling at North Carolina Central University. Phillip is a counselor here at the Duke University Medical Center Cancer Support Services. So Phillip, can you describe some of what you do here at the Cancer Support Center?
Yeah, our program is responsible for the psychosocial side of oncology care. So taking care of patients, their family, their caregivers, family however they define family to be, who is their community. And recognizing that cancer, like all things that affect us, are not isolated to one person. It affects the whole group, the support group, the care group. And so we try to do whatever we can to address the needs that arise among that community. From our counseling services, which are provided at no charge to families, to patients, to the family together if they need to come in as a family unit. Also working with the medical staff, so being a liaison with the doctors, the nurses, and the patients and families, helping translate what's being said between the doctors, between the nurses and the patients, so that when a family is experiencing emotional difficulty, they may not quite hear what's being said. Distracted by their own needs, what's going on in their life. So we like to have a counselor involved to help make sure they're hearing what's really being said and can process that as a family and make decisions appropriately.
Okay.
We do that, and then we do more hands-on with things like providing wigs and hats and turbans to patients who need it.
Mm-hmm.
Recognizing that the loss of hair is not necessarily about vanity, but also the loss of self.
Mm-hmm.
And how do we make patients still feel like the person they are and not be viewed as a cancer patient?
Okay, so a lot of practical as well
Yes.
as supportive activities
Exactly.
as well. So let's say that cancer is so widespread and folks from all over the country that perhaps wouldn't even have access to a place like Duke deal with it. As you think about folks who are experiencing cancer, what are some of the advice or maybe what kind of resources would be out there to help them?
I think look in the community. There's usually an American Cancer Society in every community, or at least within a good short drive that folks can go. And they'll provide practical support, getting people to appointments if they need be. But also Look Good, Feel Better, a program to help women learn how to reapply makeup if their skin changes, or to style wigs, the practical things. As well as then they also offer support groups, bring community groups together. I would check local churches. A lot of churches have support groups for folks facing cancer, whether it be for the patients, for the families, or all of them together.